prostate cancer screening. You know, a lot of people talk about, do I need that blood test or do I need just a physical? So learn today a little bit about the history of the prostate cancer test and screening and what you need to do to protect you and your loved ones.
Welcome, everybody, to another edition of Everyday Health Hacker. I'm Mike Herzing, along with the awesome Dr. Liza Leal.
Hello, everybody. Welcome back.
Yes, welcome back. Dr. Leal's Chief Medical Officer right here at Meridian Health Institute in Sugar Land, Texas, where they're going to keep you healthy and teach you how to stay healthy. That's what you want.
Yes, and today we're going to talk about prostate cancer screening.
Oh, boy. How much fun is that?
Well, it's important, and it's interesting because looking at prostate cancer, that type of laboratory actually hasn't changed in 30, 40 years. And it's only 20 to 40% accurate. It's not very accurate. So we always wonder, there's a lot of medications and laboratories and different, I'm going to say medical devices that get FDA approved. And going back to it, we look at the PSA, and there's a lot of doctors that just, hey, it's not even worth doing these days because it's not very accurate. However, it is one of the few things that we have right now, so it's not going to hurt you because we're going to take your blood anyway to check your cholesterol and all the other things that we check for on not monthly, but a yearly. I hope we don't have to do it on a yearly perspective. And what's interesting, we were talking about this a little bit before we started recording, is that back in the day, and I'm going to say 20 years ago, we didn't want that PSA to go over a 1.5. And
right.
Now, they would start doing biopsies at 3. And now we look at 0 to 4 as considered normal. And then for my patients that are 60, 65 and older, we actually go to a higher score even. So a lot of people will say, hey, I went to the urologist, my PSA was 12, should I be concerned? And I'm like, well, what did the urologist do? I'm like, he started you on an antibiotic, right? They're like, yeah, he put me on an antibiotic. So why do we do that? Because prostatitis, which is very common, that is an infection or inflammation that's in the prostate that an antibiotic can actually decrease. There are some antibiotics that we use as an anti-inflammatory. And we utilize that with rheumatoid arthritis, different other illnesses that are out there that are actually anti-inflammatory as well as antibacterial. So that's very interesting. And then we'll say, okay, a couple of weeks later, we'll repeat the PSA, and it'll go from a 12 down to a 4. So then we're like, okay, we're in the right direction. Now that's all we need to do, and we'll continue to follow that. And I always share with people, when the doctor says continue to follow it, I need that person to continue with following up with your doctor's visits. Just because you feel good doesn't mean everything on the inside is good. So let us do the laboratory work. Let us do the physical examinations in order to make sure that you're at your optimal health.
Yeah, those are so much fun.
Yeah, well, they are,
so
but
they're
they're important. If you look at the United States Task Force on Preventive Health, and any one of you can Google this, you'll start noticing that after certain ages, they ask you to do less and less. I know with women looking at mammograms, they're recommending, not every year, but every couple of years. I don't agree with that. I also don't necessarily agree with mammograms because they're not very comfortable. But there's new technology that's coming out. Thermograms are out there, however expensive. But there's other things that I look forward to saying soon that I'll be able to share that are out there in the laboratories that are working. So,
yeah, women have mammograms, guys have prostate stuff. It just doesn't get much fun out there.
And let's not forget the colonoscopy after the age of 45.
Been there, just had that last couple weeks ago.
And again, colonoscopy too, if any one of your family members have had colon cancer, we recommend for you to be treated with a colonoscopy 10 years prior to that person's age of diagnosis. So if they were 50, you're going to have yours at 40.
I normally don't do that on the first date. But,
lots of screening that is out there. Chest X-rays, that we used to have in every physical. We would do a chest X-ray, and that's changed. Now it's only if they're a smoker. However, now we do a CT. So we'll do a CT ever so regularly just to monitor where they are. And of course, we're always going to encourage you: don't smoke, don't drink, eat a nice healthy meal, which includes less sugar and less carbohydrate so that we can get the inflammation out of your body.
But I have a question. You just mentioned that. I've never smoked in my life, not once, ever. My parents were horrible smokers.
Secondary,
Of course,
secondhand smoke.
they both passed away, but it's a point. But whenever you fill out a form or anything, you could say, I smoked a cigarette in 1964 one time,
Yeah,
and all of a
that's-
sudden you're branded a smoker your whole life.
Yeah,
And I never have, but people have, and I'm like, is that really fair? I mean, what's the damn
It's
deal
very
with that?
important to especially online. Everything's online these days.
Yeah.
When you go to a doctor, they're going to have you fill out an online first history of your health. And I encourage everybody, fill out what you're comfortable with. And some of it might be a conversation when you see the doctor. Because honestly, let's think about it. The doctor's going to ask you anyway.
Right.
One of the things that we ask is, have you ever been a smoker? And then they'll say, yes, I used to be. Well, how long ago has it been? Well, it's been more than 20 years. Well, I'm not going to worry about that. I'm not going to even take that person as a smoker because they're 15 years from smoking. And if you look at studies today, if you are 15 years past from smoking, you're truly at a better place for your health. Doesn't mean that we're not going to monitor, because a lot of people who quit smoking might have somebody in the household that is smoking, and now we have secondhand smoke, which is also very dangerous as well.
Yeah, well, I had a friend that she was she smoked for like 2 weeks in the 11th grade, and now she was 65, and she was branded by the insurance company as a smoker.
Right.
But then somebody else was exposed to secondhand smoke her whole life from her parents, and she wasn't branded a smoker. I mean, she really should have been,
and only
You know what I mean?
because they probably didn't ask the question.
Right, and it was just funny that the insurance company, doubled her price because
Absolutely, because
And-
they put you on an actuary table to
Right.
see how expensive
that
it's
really
going to be.
wasn't fair.
It's not that it's not fair. It just goes down to the economics of it.
Right.
And I always share with people before you're going to have, truly when you're going to apply for life insurance, go and see your primary doctor and talk about it, because you might have just borderline cholesterol levels. If you get that in check, that's going to really help you as you go forward, because that means that you're taking care of yourself and that you're taking the time to do that. They're still going to see those notes because they ask for every note that was ever out there that you've
really?
ever had, whether it was a surgery in 1983. They're going to ask for everything that you've ever gone through in your life.
Everything's out there.
And some of the things that they're going to ask specifically are, has anyone in your family ever had Huntington's disease? They rarely ask if there's Alzheimer's or dementia, but they will ask Huntington's disease, which is a genetic, something that passes through. So truly, it's important to know what your history is. Some of these very rare disorders like Huntington's, there's genetic tests that you can find out about, and that might be something that you don't run through your insurance. Maybe you want to find out and you want to keep it private. That's your right to do. And again, your primary care physician can help you to assess what is needed, what's not needed, and help you to gather that information.
I know people that will go and do cash pay to a doctor because they don't want the insurance company involved in this. Now, does that doctor have to report it to the insurance company?
If they don't want the insurance to pay for it, no, they don't have to. But it's my hope that when they do go to that other doctor, that they're getting information so that they can improve themselves.
Right. I'm talking about
a
that,
lot of
sure.
times, I know with a lot of the HMO plans, a lot of patients will say, I don't like that doctor, so I don't want to go over there. But the only way that they can go and get an x-ray for the foot that they may have just broke is going through that.
Sure.
So, there's give and take when it comes to, it's truly understanding, taking the time to read that book of your insurance of what you can and cannot do. It's important to know that before there's an emergency. I think that's very important to know. Maybe when you're going to get your physical at the beginning of the year for your birthday this year, is asking that person at the physician's office to give you a little bit of information of understanding about what does your insurance card say and what does it mean, because a lot of people don't understand what's in network, what's out of network, and what your responsibility is.
Yes, always make sure that when you're going, especially to an emergency room and the different levels of care, that you're not going to one that's not going to be covered. Now, the state of Texas is really cool. That's saying there's no surprises anymore.
Yes,
Yeah,
and I like that.
I love that.
And we're also the right to try state. In other words, there's a lot of things that are out there that people have lost all hopes. But if there's something that's experimental, they have the right to try that. So
That's right.
It's we enjoy being Texans.
It's good in some way, but it takes a while to get that stuff fixed. But we've got it fixed so far. By the way, folks, if you have any questions, anything you want us to check out, any questions you want us to answer, info@everydayhealthhacker.com will get our attention. And we may use your question on the air, and we would appreciate it because we love those. And we're going to answer them.
So remember to get your physical this year, whether it's for your birthday or the beginning of the year, and find out what your steps are for whatever your age group is so that you can take the best care of you.
No, we don't want to do that. That's not fun. No more prostate stuff. No, not happening. Not happening anymore. All right. As always, on behalf of Dr. Liza and Leal, the great staff here at Meridian Health Institute, we want to tell you and ask you to have a great day, and please check out the podcast and subscribe.